Which of the following patients is most at risk for the development of a hiatal hernia? A. An 80-year-old obese male who loads trucks for work. B. A 35-year-old pregnant woman with a gastrointestinal tumor. C. An obese male who smokes cigarettes. D. An 80-year-old obese woman with alcohol-related ascites. E. A 30-year-old male professional athlete. The answer is D. An 80-year-old obese woman with alcohol-related ascites. Advanced age, female sex, obesity, alcohol abuse, frequent heavy lifting, pregnancy, gastrointestinal tumors, and smoking may increase an individual's risk for the development of a hiatal hernia. The correct scenario represents 4 risk factors. The nurse cares for a patient with appendicitis. Which of the following positions is best for improving breathing and relieving abdominal pain? A. Trendelenburg. B. Reverse Trendelenburg. C. Fowler's. D. Side lying. E. Sims. The answer is C. Fowler's. Fowler's position, head of bed, HOB, elevated 45 degrees, increases comfort, ventilation, circulation, and relieves pressure from the thorax. It would be best for this patient due to the pain experienced by the patient in the abdomen. Sims position, halfway between lateral and prone, upper arm flex, lower arm behind patient, is used when a patient is receiving an enema or an examination in the perineal area. Trendelenburg, HOB lowered, feet elevated, is used for patients with hypotension, as it promotes venous return. Reverse Trendelenburg, HOB elevated, feet lowered, is used to promote gastrointestinal problems by minimizing esophageal reflux. Side lying, patient on side with top leg in front of bottom leg and hip, knee flexed, is used to relieve pressure from the sacrum and is often rotated with patients who are on bed rest. A 35-year-old client is being discharged post-hemorrhoidectomy surgery. The nurse is explaining in detail all discharge instructions to be followed for a successful post-operative period. The client will need to adhere to which of the following instructions? A. Avoid pain medications post-procedure as they may cause constipation. B. Avoid bowel movements until sutures are removed. C. Use of daily enemas to promote frequent bowel movements. D. Take oral pain relievers prior to bowel movement to reduce discomfort. E. Use of rectal suppositories in place of oral stool softeners. The answer is D. Take oral pain relievers prior to bowel movement to reduce discomfort. To prevent pain during a bowel movement post-operatively, pain medication is often indicated to help make it more tolerable. Pain medications will need to be given post-op and may contribute to constipation, but oral stool softeners and a high-fiber diet can help to avoid the constipation. Rectal suppositories and daily enemas are not needed. Bowel movements should not be delayed nor avoided in the post-operative period. A client is being treated on the medical surgical unit for pneumonia and has recently developed severe diarrhea. Upon cultures performed, it has been determined the client is now carrying Clostridium difficile, C. diff, and will need to be on special precautions to prevent the spread of this disease. All of the following are consistent with the appropriate precautions when dealing with those infected with C. difficile except dash. A. All persons having direct contact with the client will wear a mask, including healthcare workers and visitors. B. Healthcare providers, as well as visitors, will put on gloves and wear a gown over their clothes while interacting with clients with C. difficile. C. Hospital rooms and medical equipment that have been used for clients with C. Difficile must be disinfected and cleaned thoroughly. D. When possible, client will occupy a private room or share a room with another C. Difficile client. E. All healthcare persons interacting with the client will wash their hands with soap and water or alcohol rub prior to contact. The answer is A. All persons having direct contact with the client will wear a mask, including healthcare workers and visitors. This client is to be aware on contact precautions. The wearing of a mask is consistent with airborne precautions, which is not necessary for C. diff. All other choices are appropriate for contact precautions. Overdose of which of the following over-the-counter medications is one of the leading causes of liver failure in the United States? A. Diphenhydramine. B. Acetaminophen. C. Loratadine. D. Cimetidine. The answer is B. Acetaminophen. Acetaminophen causes more liver failure in the United States than viral hepatitis, making it one of the most common causes of liver-related emergency room visits. It causes approximately 78,000 emergency room visits and 150 deaths due to liver failure each year. None of the other medications listed are associated with liver failure. The majority of hepatic infections are with which of the following type of microbe? A. Bacteria. B. Fungi. C. Prions. D. Viruses. The answer is D. Viruses. The majority of liver infections are viral in nature. Hepatitis A, hepatitis B, and hepatitis C are the most frequent agents of infection, with hepatitis C being the leading cause of liver transplants. Bacterial infections in the liver most commonly take the form of an abscess. Fungal hepatitis and prion infection of the liver are not generally seen. Which of the following viruses can cause hepatitis? A. Yellow fever. B. Cytomegalovirus. C. Epstein-Barr. D. All of these. The answer is D. All of these. There are multiple viruses that can cause hepatitis other than hepatitis A, B, or C. Among these are Epstein-Barr virus, cytomegalovirus, and yellow fever. You are the nurse for a new patient brought to the emergency department for a suspected gastrointestinal bleed. The patient is tachycardic and hypotensive, but conscious, responsive, and breathing spontaneously without any airway trouble. Which of the following is the best initial intervention? A. Insert 2 large bore peripheral IVs. B. Prepare to intubate the patient. C. Administer hydromorphone. D. Administer lorazepam. E. Administer warfarin. The answer is A. Insert 2 large bore peripheral IVs. This patient is suffering from a suspected gastrointestinal bleed, and based upon the report of the vital signs, he is hemodynamically unstable. In evaluating an emergency trauma patient, the ABCs must be assessed: A. Airway, B. Breathing, C. Circulation. In this patient's case, it is stated that he is responsive and breathing without any issues, indicating that his airway and breathing are both satisfactory. The next issue is his circulation. Given that he has a suspected bleed, and is tachycardic and hypotensive, it is likely that he is losing a significant amount of blood from his bleeding viscera. As such, he may need emergent, rapid fluid and/or blood product resuscitation. The best way to prepare for this immediately is to place 2 large bore peripheral 4 lines, such that resuscitation can be provided through these lines while the rest of the workup and treatment continues. Any delay in placing these lines delays the fluid, blood resuscitation of the patient, which can be dangerous. At this point, given that the patient has a protected airway and is breathing without issue, intubation would not be indicated. Should his airway or breathing status change, the need can be reassessed. Administering hydromorphone, a potent opioid, may be necessary if the patient is in a significant amount of pain, but that would not be the most pressing initial concern given that he is hemodynamically unstable. Administering warfarin, an anticoagulant, would be highly contraindicated in this patient, as he likely has an active gastrointestinal bleed and is hemodynamically unstable. Administering lorazepam, a benzodiazepine, is not indicated in this hemodynamically unstable patient with a suspected gastrointestinal bleed. After stabilization and continued demonstration of airway protection, if the patient is anxious, this need can be reassessed. You are the nurse taking care of an 83-year-old patient with a history of gastroesophageal reflux disease, GERD. They complain that they are having heartburn symptoms at night when trying to go to sleep and in the morning when they wake up. In addition to addressing their medical therapy options, you recommend which of the following to the patient? A. Do not take calcium carbonate for symptomatic relief. B. Avoid spicy foods before going to bed, but otherwise eat a whole meal right before going to bed. C. Eat your last meal at least 3 hours prior to going to bed, and sleep as upright as possible, with multiple pillows. D. Eat immediately prior to going to bed. E. Drink 1 cup of coffee prior to going to bed. The answer is C. Eat your last meal at least 3 hours prior to going to bed, and sleep as upright as possible, with multiple pillows. This recommendation involves fairly simple lifestyle changes that have the potential to greatly decrease the patient's symptom burden. Heartburn symptoms can be exacerbated in patients who eat spicy foods, at any time, who drink coffee, and/or who eat meals shortly prior to going to bed, since the food can physically reflux back to the distal esophagus from the stomach prior to being digested more completely. Thus, any of those recommendations would be inappropriate. Further, in a patient who is acutely experiencing acid reflux symptoms, it is typically appropriate for them to take calcium carbonate to neutralize the acid and relieve symptoms. As such, advising the patient to not eat immediately prior to going to bed, and to remain upright, to physically minimize reflux of contents, would be the most appropriate recommendation. You are a nurse at an oncology infusion center taking care of a 45-year-old female with breast cancer, currently being treated with chemotherapy. While receiving her chemotherapy infusion, she complains of severe nausea. Which of the following medications would be most appropriate to treat this patient's nausea assuming she has a normal QTc interval? A. Acetaminophen. B. Ketorolac. C. Ibuprofen. D. Meloxicam. E. Ondansetron. The answer is E. Ondansetron. This patient, who is actively being treated with chemotherapy and experiencing severe nausea, is most likely suffering from chemotherapy-induced nausea. The most appropriate first-line treatment for chemotherapy-induced nausea in a patient with a normal QTc interval is ondansetron, also known as Zofran. Ondansetron is a serotonin 5-HT3 receptor antagonist, likely accounting for its anti-nausea properties. A side effect is QTc interval prolongation, and as such, careful consideration as to whether or not to prescribe ondansetron should be given for patients with baseline prolonged QTc intervals. Acetaminophen, an analgesic, Would not treat nausea, nor would ibuprofen, meloxicam, or ketorolac, all NSAID medications. You are the nurse at a primary care clinic taking care of a 40-year-old male who is undergoing his routine annual well check. His only complaint is that about once per month, when eating spicy food or drinking significant amounts of alcohol, he experiences heartburn. Which of the following would be the most appropriate recommendation? A. Take over-the-counter omeprazole daily for 1 year. B. Go to the nearest emergency department immediately, as this could be indicative of a heart attack. C. Take over-the-counter ranitidine daily for 1 year. D. Take 1 to 2 tablets of calcium carbonate every 3-6 hours as needed for heartburn symptoms, and if you symptoms more frequently or severely, return to clinic. The answer is D. Take 1 to 2 tablets of calcium carbonate every 3 to 6 hours as needed for heartburn symptoms, and if you experience symptoms more frequently or severely, return to clinic. This patient is apparently healthy 40-year-old male whose only complaint is very infrequent heartburn that occurs in response to specific trigger foods and drinks, spicy foods and alcoholic beverages. In a patient who experiences mild to moderate heartburn, or acid reflux, symptoms infrequently, meaning less than 3 times per week, the appropriate initial recommendation is to take over-the-counter calcium carbonate tablets as needed, as these will directly neutralize the excess acid in the distal esophagus and stomach. For the majority of patients with infrequent heartburn brought on by known trigger foods and beverages, this will be sufficient to provide symptomatic relief. It is inappropriate in a patient with infrequent heartburn who has not yet tried, and failed, calcium carbonate to initiate ranitidine or omeprazole treatment, as these are more potent methods to suppress intrinsic stomach acid production, and are not necessarily required to provide symptomatic relief for these patients. If the patient in this example was experiencing more frequent heartburn, more severe heartburn, or heartburn that was not adequately controlled by calcium carbonate, then ranitidine or omeprazole would be reasonable options. The best initial treatment option for a patient with heartburn is not acetaminophen, an over-the-counter analgesic. Heartburn is caused by reflux of acidic gastric contents into the distal esophagus. The best initial treatment for an acute episode of heartburn is calcium carbonate, as this will directly neutralize the acid that is causing symptoms, and provide symptomatic relief for most patients. It would be inappropriate to send this patient immediately to the emergency room as he is not currently experiencing heartburn symptoms. His symptoms are highly consistent with heartburn, as opposed to a cardiac etiology, given that they are brought on only infrequently and directly in response to trigger foods and beverages. If the patient was actively complaining of chest pain, and more concerning aspects of his pain were elicited that suggested a cardiac etiology, then an immediate referral to an emergency department would be a more valid consideration. A client presents to the clinic for fecal occult blood testing, FOBT, as part of his colorectal screening appointment. The nurse previously instructed this patient to avoid certain foods for 48 to 72 hours prior to testing. All of the following foods were to be avoided except A. Turnips. B. Prunes. C. Beets. D. Red meat. E. Cantaloupe. The answer is B. Prunes. There are many foods not to be ingested just prior to FOBT. Prunes are fine to eat. Red meat, broccoli, cantaloupe, beets, turnips, carrots, horseradish and several others may alter the test results and should be avoided before a FOBT. A 70-year-old female client is being treated as an outpatient for diverticulitis. The nurse explains that there are several complications associated with this disease. The nurse informs the patient that diverticulitis is the most common cause of what complication? A. Renal failure. B. Severe diarrhea. C. Bowel obstruction. D. Peritonitis. E. Lower gastrointestinal bleeding. The answer is E. Lower gastrointestinal bleeding. Diverticulitis is the most common cause of lower GI bleeds. Peritonitis and bowel obstruction are possible complications, but not most commonly associated with diverticulitis. Renal failure and severe diarrhea are not complications of diverticulitis. The pediatric nurse assesses an 11-year-old patient in the emergency department. The child's parent explains the child's signs and symptoms from the last few days. Which of the following statements by the parent is most important to the nurse? A. He was complaining about a strong pain in his stomach, on the right side above his hip. B. He has a fever around 99.5 degrees Fahrenheit and has thrown up a few times. C. He has been feeling this pain for the 2 days, but it suddenly went away. D. When he walks, he holds his arm around his stomach. E. He hasn't been eating very much since the pain started. The answer is C. He has been feeling this pain for the 2 days, but it suddenly went away. This patient is experiencing signs of appendicitis, which include periumbilical abdominal pain, usually originating in the right lower quadrant, anorexia, nausea, vomiting, localized tenderness, muscle guarding, and a low-grade fever. Appendicitis is frequently diagnosed in young children and young adults with these symptoms and a white blood cell count from 15,000 to 20,000 cells per cubic millimeters. The nurse should be most concerned if the pain has suddenly ceased, which may be a sign of perforation, which is an emergency due to hemorrhage and infection risks. The pediatric nurse cares for a young child admitted with appendicitis. Which of the following signs and symptoms most concerns the nurse? A. Distended abdomen and abdominal rigidity. B. White blood cell count of 18,000,16,000, and 17,000 cells per cubic millimeters over 3 days of hospitalization. C. Temperatures of 99.6 degrees Fahrenheit, 99.2 degrees Fahrenheit, and 99.4 degrees Fahrenheit on the shift. D. Tenderness of the abdomen in the right lower quadrant. E. Anorexia, nausea, and vomiting. The answer is A. Distended abdomen and abdominal rigidity. Without treatment, appendicitis can lead to peritonitis or perforation. Typical signs and symptoms of appendicitis include periumbilical abdominal pain, anorexia, nausea, vomiting, localized tenderness, muscle guarding, and low-grade fever. The normal WBC count for a patient with appendicitis ranges from 15,000 to 20,000 cells per cubic millimeters. The nurse caring for a patient with appendicitis should always be aware of particularly concerning signs or symptoms of peritonitis, especially those that differ from established baseline signs and symptoms. Many of the symptoms of appendicitis may be apparent with peritonitis, especially tenderness, fever, and white blood cell counts. When assessing for peritonitis, the nurse should specifically look for abdominal rigidity or distension, rebound tenderness, increased, severe abdominal pain, ascites, increased temperature, increased leukocytosis, and paralytic ILS. What is the incubation period of hepatitis B, HBV? A. 1 to 2 weeks. B. 2 to 4 days. C. 1 to 6 months. D. Up to 2 years. The answer is C. 1 to 6 months. Hepatitis B has a long incubation period. From the time of initial infection, symptoms might take from 1 to 6 months to appear. A patient just returned from a trip outside of the country and is now experiencing fever, nausea, and vomiting. She tests positive for hepatitis A IgM. She would like to know if hepatitis A is a chronic infection, or if it will resolve with treatment. The nurse should advise her which of the following? A. Hepatitis A is not a chronic disease and it does not exist in a carrier state. Once the infection is resolved, you will no longer have hepatitis A. B. Hepatitis A becomes chronic in 25% of cases. Monitoring for viral DNA should be repeated every 6 months. C. Hepatitis A becomes chronic in 75% of cases. Monitoring for viral DNA should be repeated every 6 months to 1 year, but you will likely always carry the disease. D. Hepatitis A generally does not become a chronic infection, but you will always be a carrier of the disease. The answer is A. Hepatitis A is not a chronic disease and it does not exist in a carrier state. Once the infection is resolved, you will no longer have hepatitis A. Hepatitis A is a generally benign, self-limiting disease that does not develop into a chronic hepatitis. It also cannot exist in a carrier state. Once the virus is cleared by the immune system, the individual will no longer carry the virus or be infectious to others. Hepatitis B can be transmitted via any of the following routes except A. Blood. B. Stool. C. Vaginal fluids. D. Semen. The answer is B. Stool. Hepatitis B is primarily transmitted via blood, vaginal secretions, and semen. While the virus is often present in saliva, it is not generally spread by sneezing, kissing, or sharing utensils, unless there are oral abrasions resulting in a mutual exchange of blood. The virus does not have fecal-oral transmission. A patient with pancreatitis is placed on an NPO order. What does this order mean? A. The patient cannot walk. B. The patient cannot eat only. C. The patient cannot drink only. D. The patient cannot eat or drink. The answer is D. The patient cannot eat or drink. NPO means is a Latin phrase meaning nothing by mouth. This order is used when a patient is not allowed to eat or drink any substances, usually due to a disturbance within the GI tract or if they are scheduled for a surgery. NPO orders are common in the ICU and surgical setting. A client with Crohn's disease is asking the nurse how to accomplish a low residue, low fiber diet. The nurse will tell the client to avoid A. White bread. B. Cooked potatoes. C. Refined pasta. D. Apples. The answer is D. Apples. Crohn's disease is an indicator for a low residue, low fiber diet. The diet should include foods that are unlikely to obstruct the intestinal tract if narrowed by inflammation or scarring, or if gastrointestinal motility is slowed. The home health nurse visits the home of a patient who has just been discharged from the hospital after a small bowel resection. Which of the following patient statements concerns the nurse? A. I enjoy eating cornbread with my dinner. B. I drink a lot of apple juice. C. I make my sandwiches with white bread and smoked turkey. D. I limit the amount of milk I drink to 1 glass each day with breakfast. E. I have stopped drinking coffee every day. The answer is A. I enjoy eating cornbread with my dinner. Patients recovering from lower bowel surgery, such as small bowel resection, must adhere to a low residue diet to minimize intestinal activity. A low residue diet includes white breads, cereals, and pastas, well-cooked vegetables without skins, fresh fruits without peels or seeds, tender and well-cooked meats, limited dairy, meat broths and strained soups, and clear juices. The patient must avoid high residue foods, including whole grain breads such as cornbread, strong cheeses and yogurt, raw vegetables, dried fruits or legumes, juices with pulp, coffee or other caffeinated beverages, popcorn, nuts, and seeds. Which of these is a proper lifestyle change to fight gastroesophageal reflux disease, GERD? A. Cessation of soda intake. B. Decreasing fluid intake. C. Eating acidic foods. D. Increasing spicy food intake. E. Eating meals less than 1 hour before bedtime. The answer is A. Cessation of soda intake. Soda intake exacerbates symptoms of GERD. Along with this, individuals should wear loose clothing, exercise regularly, drink plenty of fluids, avoid eating within 1 to 2 hours of bedtime, and avoid spicy and acidic foods. A nurse is counseling a 60-year-old woman who recently found out that she has chronic hepatitis C. She is not sure how she became infected, though she does state that she had a blood transfusion in 1989 due to postpartum hemorrhage. She is concerned about the stigma of the disease and wonders how common it is in the United States. The nurse informs her of which of the following? A. Hepatitis C is the most common chronic blood-borne infection in the U.S. 3.9 million Americans have had or are currently infected with the virus. B. Hepatitis C is the third most common chronic blood-borne infection in the U.S. 2 million Americans have had or are currently infected with the virus. C. Hepatitis C is a rare infection. There are currently approximately 30,000 people in the United States living with this disease. D. Hepatitis C is not particularly common. Approximately 300,000 people in the United States have a current or past infection with the virus. The answer is A. Hepatitis C is the most common chronic blood-borne infection in the U.S. 3.9 million Americans have had or are currently infected with the virus. Hepatitis C is the most common chronic blood-borne infection in the U.S. Approximately 3.9 million Americans have antibodies against the virus. Of those, approximately 70%, 2.7 million, have chronic hepatitis C infections. Most pituitary adenomas are non-functional, incidentalomas. Of the functional adenomas, which are the most common? A. Null cell adenoma. B. Prolactinomas. C. Gonadotrophic adenomas. D. Somatotrophic adenomas. The answer is B. Prolactinomas. Prolactinomas, prolactin secreting, make up 30% of functional pituitary adenomas. The second most common type are somatotrophic, growth hormone secreting, adenomas, which make up 15%, followed by gonadotrophic, gonadotrophin releasing, adenomas, which make up 10% of reported cases. Null cell adenomas are non-functional, they do not secrete hormones. Which of the following are common cardiac signs with hyperthyroidism? A. High cardiac output, tachycardia, and atrial fibrillation. B. Diastolic murmurs and low cardiac output. C. Atrial stenosis and tachycardia. D. Premature ventricular contractions and low cardiac output. The answer is A. High cardiac output, tachycardia, and atrial fibrillation. A cardiac workup on a patient with hyperthyroidism will often reveal high cardiac output, tachycardia, atrial fibrillation, a prominent, fourth heart sound, S4, and flow murmurs. This condition is not associated with low cardiac output, and while it may be seen with murmurs, it is not specifically associated with atrial stenosis.